Hi, my name is Dr. Joe Childs. I'm a chiropractor, but I'm also a specialist in functional neurology. What that basically means is I not only treat the vertebral column, the bones of the spinal column, but I also treat the brain and the central nervous system. I'm also a specialist in treating patients with chronic pain and chronic neurological conditions. And on this DVD today, I'm going to talk to you about fibromyalgia. I'm also going to cover some of the latest, most revolutionary treatments for fibromyalgia. I've been treating patients with fibromyalgia now for 10 years, and I treat it successfully. I've had patients with chronic pain. I've helped them get over chronic pain they thought they were going to have to live with the rest of their life. In fact, at the end of this DVD, you're going to be able to hear some of our patients' testimonials of how we help them with their chronic fibromyalgia. Or if you're watching this on the web, you can go to AskDrChildsDrDurr.com, AskDrChildsDrDurr.com, and you can see a whole bunch of video and written testimonials of patients we helped. Back to talking about fibromyalgia. One of the things that I want to cover on this video is I want to cover the cause of fibromyalgia. Because what I have found is most patients with fibromyalgia have absolutely no idea why they feel the way they feel. In fact, a lot of doctors have no idea what really causes fibromyalgia. Most people are shocked to find out that fibromyalgia is not just a muscular problem. In fact, it's not a muscular problem at all. You feel it in your muscles, but fibromyalgia is not a muscular problem. Fibromyalgia is a neurological problem that needs to be treated neurologically. So what I want to do in this DVD is I want to talk about a brain-based treatment and analysis of fibromyalgia. And I want to talk about how we help patients with fibromyalgia, because most people with fibromyalgia, when they come into my office, they tell me they feel like they have the flu. That achiness that you get with the flu, that all-over body ache, only these patients have it 24/7, 365 days a year. You're not sleeping well. Most patients with fibromyalgia, they have insomnia. You have chronic pain all through your body. And your life is just not the way it used to be. Your quality of life, the things that you used to do, you're not able to do those things. So one of the things we do differently is we do a brain-based, neurological-based treatment program. We do brain-based tests to find out why you have the problem. So when somebody comes into our office with fibromyalgia, when they hit the door with fibromyalgia, the first thing we want to do is we want to do a very thorough consultation. Because our treatment philosophy is to treat the individual, not just the diagnosis. Now, we're very concerned about the diagnosis that you come in with. We want to, whether it be chronic fatigue, whether it be fibromyalgia, whatever you have when you come in, we're concerned about that. We're going to look at your MRIs. We're going to look at all of your past medical history. But what we really want to do is we want to sit down with you toe-to-toe, knee-to-knee, and find out why you feel the way you feel. We want to find out how this has been affecting your life. We want to find out the things that you've not been able to do, how your quality of life has been reduced. We want to understand you individually, because every patient with fibromyalgia, although a lot of them are very similar, the majority of them are very different in some ways as far as how it came on. And we're going to talk about the cause and how fibromyalgia occurs. The other thing we want to do is, when you come into our office, is we want to do a very thorough neurological exam. We also want to test you metabolically. We're going to talk more about that on this video. Before we talk about the neurological testing that we do in our office, what I'd like to do is go over the cause of fibromyalgia. Why you have chronic pain all through your body. Why you get migraine headaches. Why you have irritable bowel syndrome. One day you've got constipation, the next day you have diarrhea. Why you have chronic fatigue and insomnia, where you just can't get to sleep at night. Why a certain part of your brain is not feeling the way it used to feel, meaning you have this Fibro Fog. You're not able to express the things that you want to say. The words are on the tip of your tongue, and you're not able to really express yourself fully, because this area in your brain, the frontal lobe, the left frontal lobe, area 44, Broca's area, is not firing the way it fires. See, all of these things come into play, and the brains of people with fibromyalgia simply do not work the way the brains work of patients that don't have chronic pain. So what I want to do is I want to use this model. This is a plastic model of the human brain, and we're going to use this today to kind of get you to understand how patients get fibromyalgia and how the nervous system is the culprit. So when you look at a brain here, you have higher areas of the brain, which is called the cortex. A lot of times when you look at this area, most patients will think that that's really the brain, and it is the brain, but we can call that the cortex. And you have the lower aspects of the brain, which are the brain stem, and the back part of your brain, which is the cerebellum. The cerebellum is this part right here. They call it the little brain. It's the part right in the back. On this poster, you can see it right here. Now, the lower brain stem, or the brain stem, can be divided up into two parts. It can be divided up into the lower brain stem and the upper brain stem. The lower brain stem is the pons medulla. The upper brain stem is the mesencephalon, or the midbrain. But we'll just call it lower brain stem and upper brain stem to make it easier. So normally what happens is messages from the cerebellum will fire messages up to the brain, and then the brain will send messages down to the lower brain stem. And then what the lower brain stem does is the lower brain stem slows down the upper brain stem. It sort of mutes it, because the upper brain stem is kind of like an unruly teenager in that it needs a lot of supervision. And it gets its supervision from a lower brain stem. When the lower brain stem is firing good, the upper brain stem is going to be in check. Okay? Now, what happens with patients in fibromyalgia is a lot of times the back part of their brain, the cerebellum, won't be firing the way it needs to fire. It's not sending messages as vibrantly as it needs to. And the cerebellum controls your balance, it controls your coordination, it controls all your spinal postural muscles, and it also controls your equilibrium. So a lot of patients with fibromyalgia, not only do they have chronic pain, but what I have found is a lot of them have balance disorders. Some days they've got vertigo, they've got dizziness, their posture is not good because the cerebellum controls the posture. They tend to be they kind of tend to slump forward, and the cerebellum is the culprit. Now, the cerebellum sends messages up to the upper brainstem. Okay, excuse me, the cortex, and then the cortex sends messages down to the lower brainstem. Now, when I say sending messages, I'm gonna talk about the brain firing or not firing, and what I'm talking about is a soft versus a hard lesion. Now, in neurology, you have one or the other. A hard lesion is things like multiple sclerosis, MS, a tumor. A hard lesion is also an area where you have a stroke, where there's actually damage to an area in the brain. That's a hard lesion. What we're talking about is a soft lesion. What a soft lesion is an area in the brain that's not as vibrant as it needs to be. It's not sending messages as well. And so what patients with fibromyalgia are missing is they're missing that loop from cerebellum to brain down to the lower brainstem, and what that causes is it causes the upper brainstem to go too fast. We call it a high-firing upper brainstem or a high-firing mesencephalon. When that happens, you can get all types of problems. That's when you develop all types of havoc in your body. One of the things that can happen when that upper brainstem gets overactive, or it gets irritable or overstimulated, is you can get headaches. The upper brainstem is the center for the sympathetic nervous system. And the sympathetic nervous system, when it's firing too fast, can cause the blood vessels in the brain to dilate, to contract, and they do not supply blood to the brain tissue properly. That's why patients get migraine headaches when they have a high-firing upper brainstem. The other thing that can happen is insomnia. Patients with fibromyalgia classically have insomnia. And the reason why that happens is when the upper brainstem is firing too fast, there's an area in the upper brainstem called the mesencephalic reticular activating system. When that's going too fast, you're just not sleeping, because it controls your wakeful and your restful states. That's why patients with fibromyalgia, they may fall asleep. Some of them don't even fall asleep at all, but if they do fall asleep, they get back up, and a couple hours later they're up and they can't get back to bed. That leads to chronic fatigue. The other thing we talked about with fibromyalgia is this Fibro Fog, and that happens because the brain as a whole is not firing as properly as it needs to, and you just feel your focus is gone.